Hi, it's Michael with postural exercise number 6. Make sure you did 1 through 5 already in the right order and sequence, and you're ready for number 6, called the hip opener. You're going to do it one time only per side. It's really important to do this one to put stabilization into your low back and pelvis so you can get pain-free in your back and neck. On your back, cross your ankle over your opposite knee. Arms are going to be at your side, palms up, or away from you, palms up. Okay? Have your ankle on your knee. Now this one you're going to do is gently, without using your hands, only using your glute muscle, you're going to push that knee away. So right here, she pushes her right knee away, holding that hip open for 30 seconds. Gently. You're not trying to crush it. You're not trying to really force it open. So push that knee away and activate that hip rotator and hold it 30 seconds, 45 seconds. You're working up to a minute over like a week or two, okay? And then you're gonna switch. So that's level 1. Level 2, if your back is feeling good, you can lift the other leg up at a right angle. So make sure that left leg is up at a right angle and it's not rotating inward towards the midline. Make it in line with her hip, make it in line with your hip, right angle, and then you're pushing that knee away from you, not with your hands, but on your own. With your own muscles, push that knee away from you. 30 seconds, okay?